Eric, I'm going to be honest with you. I learned a lot in this episode, and I just want to make a public announcement that the film Junior, starring Arnold Schwarzenegger and Danny DeVito, is entirely inaccurate. And I feel like before they show that movie, there should be some sort of disclaimer because, yeah, there's so much I learned.
You know what? Some people have characterized the modern age as the age of documentaries that mislead us. We've discussed game changers,
Hmm.
and there are others. In almost every spectrum of reality. So, but it hasn't just begun. This has actually been a history of cinema. When you and I, and let's be honest, this is the cult. This is iron culture.
It is.
Arnold Schwarzenegger has been, a cultural icon in our community for a long time. And when he made the documentary film Junior, I we were young,
Yeah.
and we just like we believed in the tale of that special forces team that did meet an alien out in the jungle.
Mhm.
Our one first contact documentary that's out there. I'm starting to question that too. Like, it makes me wonder if the catalog of Arnold Schwarzenegger documentaries might have some flaws. So first, let me just say,
Yeah.
I'm proud of us, Omar. Both of us have been able to step away from a worldview we had
Right.
using Junior as a documentary about pregnancy, birth, and all things, pregnancy and health to actually learning from true experts. And I just hope we can be a model for people who might look to the current generation of Netflix documentaries as their sole source of information.
It's hard, even recognizing that your once beloved hero could potentially be wrong. I mean, I gotta be honest. I wanted Arnold to be my teacher ever since I saw Kindergarten Cop. You know,
Hmm.
and just to know that sometimes you might believe in something that turns out to be wrong. A lot has changed, but I am very grateful. I could say this, and I do want to be now serious for a second and say it doesn't matter if you've been pregnant before, if you're currently pregnant, if you perhaps potentially plan on being pregnant in the future. It doesn't just concern those categories. If you're a educator, if you're a lifter, if you're someone that's trying to assist other people, so a personal trainer, if you're the health and fitness industry, this is entirely relevant information that we have from two powerhouses today. And Eric, we kind of were exchanging this before, where I was a trainer for a long, long time. Did train some women that were pregnant, and this is information that should be essentially mandatory, right? When it comes to being an educator, a trainer, a coach. But I learned so much that it was clear that, much like Junior, I wasn't getting the full picture.
100%. I learned a lot. Like, in all seriousness, I learned a lot in this episode, and it's stuff I feel like I should have learned. I think I've been an educator in this space of personal training. I've taught courses on like special populations for personal trainers and things like that. And in general, I would say that exercise during pregnancy is taught and viewed as like a special population niche, fitness thing. And sure, it's a restricted time period, but if we just think about the numbers, this isn't like someone having a relatively rare disease or condition. The majority of personal training clients are women,
Yeah.
and the majority of women will become pregnant at some point. So how can we say that's a niche or special population? I don't think we can. I definitely don't think we should.
The niche
Um,
majority, Eric.
Exactly, exactly. It's a small majority, but it's still a majority. It's a small, vocal majority that just needs to be ignored. I think is the way we treated it before.
Yeah.
So we're trying to change that here at Iron Culture today, and to help us do that, because we were going to do this episode without guests. We pitched the idea of maybe using Junior as a model, and I'm really fortunate that these two experts decided to take a little more lead in this episode, so that it wasn't a Junior informed episode. So in fact, we have Marika Hart on, who is a musculoskeletal physiotherapist. She's based in Perth, out in Western Australia. Um, she's been a physio for the better part of 2 decades, coming up on 20 years, and she specifically works with pregnant women or those who just had a baby. And she's currently completing a master's degree in continence and pelvic health. So she's right on topic as far as this. She's a true clinical expert, and she's joined by none other than Molly Galbraith, the head honcho over at Girls Gone Strong. She's a CSCS, and she's at the helm of an organization and one of the co-founders that is doing the best they can to empower women through fitness and using evidence-based practice. And they have a lot of industry-leading educational material, which you can find linked in the show notes. But anyway, these two fabulous guests join us today to teach us and you all the ins and outs of training during and after pregnancy.
No, I just want to echo exactly what Eric said, that we're very grateful to have both Molly and Marika in order to educate the viewers. We learned that hey, I bet this was interesting for Eric for a change, because normally you're leading the charge to just learn something on the topic where while we're talking about it. Remember, there was a little questionnaire they asked us to guess the percentage. I mean, my man did all right. I mean, he guessed right on point. But to be able to learn and then pass it on, because as you said, Eric, if we are two people that have been in the industry for such a long period of time, and we should have known this, but we don't know this, just think about the general population. So very lucky to have both of them on. We have linked in the description some further resources if anyone's interested, and go ahead and pass this message along to, anyone that you'd find relevant. Once again, the educators, the trainers, the toners, we got you. Eric, this is kind of a paradox, this episode, because what intrigued us about this and what immediately caught our attention, we were told that there's another podcast. We got a full disclosure. I've heard a handful of people listen to it, less than a handful if you minus the host. And there is a host on there by the name of, I believe, Gregathy Knuckles. And I've heard on good authority that he's a rogue AI. And so he basically knows everything that a human can possibly know. But I was told...
And more.
That's what I'm saying. He can see the future. And I was told by one of our guests that he said after the episode featuring these guests that he was blown away, quote, blown away, and he's learned more in that episode than he has pretty much ever. And so I don't know what's going on. I don't know if we're ready for this amount of knowledge. It's kind of like what happens when you gaze upon the abyss, Cthulhu style, where it's beyond our comprehension and understanding. We might just... This might be the last episode, because we might go insane after it.
My first thought is, given that all AIs start as a program somewhere, that it was probably some like incel hacker who originally programmed Greg. And man, he's come a long way since. Let me just say that. But the fact that he had so little information on the specific topic we're going to cover today, I think it gives me a little pause as to the roots of the program that is Greg Rith. What's his first name that you said?
Greg, I believe it's pronounced Gregathy, Eric.
Gregathy. Got it. Of course. It totally makes sense. All right. Yeah, so I think there's another thing we have to address beyond that. So our amazing guests, we have Molly Galbraith, CSCS, the founder of Girls Gone Strong. And we've also got Marika Hart, a physio with 2 decades of experience, master's degree, and expertise in women's health. We've got a lot of really capable people on right now, 2 to be specific. And then there's me and Omar. The problem is, and I've got to let you guys know this, so we've been looking to pivot Iron Culture. What we're going to have is what's called the Masculinity in Crisis Tour. Because as you both know, the current role of the male is starting to dissipate in our society. We are powerless. And Omar and I are changing that. So it's called the Out Alpha Tour. And we've seen the interest and the numbers, they're really starting to suffer. Every time we have a female guest on, a certain segment that would probably be the Out Alpha Tour would appeal to them, they tend to lose interest. We're not sure what's going on there. Maybe we don't understand exactly the demographic we're trying to market to. However, I think you guys are going to help us uplift this, because one thing, and again, I'm not a specialist in reproductive health, but I'm pretty sure that males come originally from being born from females. And now fact check me. Is that accurate?
What? Yeah.
She tuned out, understandably. Is that accurate? Do males come from women? From women.
Yeah, calling him an incel AI. Do you know what? I can't even remember. I think so. I think the egg decides.
Okay. So Perfect. See, I mean, we gotta start with
You know more than me about some stuff. That's cool.
no assumptions is what we got to start here with. So, pregnancy, that's something that women typically experience compared to male on I think like a per capita basis. So women do give birth to men. Men are the people we're trying to market to. Therefore, thank you so much for you both supporting our Out Alpha tour. Omar, do you think that's a fair statement? Indirectly, maybe?
I don't think anyone can misconstrue what you said, Eric. And if they did, we're going to sue their ass because that's what we do with fire and brimstone.
Mm-hmm. Well said. Okay, in all seriousness, thank you both for being on. I'm glad we had the time before we started recording to warn you how we like to roll. But Molly, if you could please introduce yourself after we had, an expert confirm our first scientific fact. Now that they've learned something, now we'll properly introduce our guests. So, Molly, thank you for being on. If you could please introduce yourself to the cult.
Thank you both for having me. I was going to try to escape after you kind of explained to me how the show was going to go, but I thought that might be a little awkward. So I'm still here in case people are paying attention. I am here. I wasn't able to leave. My name is Molly Galbraith. Like Eric said, I'm co-founder of Girls Gone Strong. So we are an education company that educates women and health and fitness professionals who work with women on women-specific health, fitness, nutrition, and pregnancy topics. So we really pride ourselves and providing evidence-based, interdisciplinary, body-positive, comprehensive health, fitness, nutrition, and pregnancy information. I've been in the industry almost 17 years now, which is kind of hard to believe. So I am, like you said, a CSCS through NSCA, former gym owner. I have dabbled in figure competitions. Please don't look for those pictures online. Dabbled in figure competitions and powerlifting a little bit, and sold my gym in 2014 as Girls Gone Strong kind of started to take off. And since then have been working on just developing education for women and health and fitness professionals on these topics and working with awesome people like Marika, a fantastic interdisciplinary team of professionals to create that education.
Fantastic. Welcome. Thank you for being on. And as you said, you can't escape. And the glue that binds the cult together is awkwardness and social pressure. So this is
perfect.
Marika, thank you also for coming on. Please introduce yourself.
You're welcome. And by the way, quick Google, it's a sperm. So it's all up to you guys.
As you know what? And we're back, folks. The Masculinity in Crisis Tour, back on top, Out Alpha. Check in a store near you, because it's probably not on our social media because it's fake. Absolutely. The sperm decides. I'm going to get that shirt and start selling it. I love it.
Yeah, so look, I'm based in Perth in Western Australia. I have fingers in a sports medicine clinic where I predominantly work with pregnant women or women who had babies recently. And I also do a lot of general pelvic health, which includes men who've had prostate surgery. So they have lots of issues with incontinence and sexual dysfunction. So I work with those fellas as well. I'm currently working at a big maternity hospital. So I'm seeing women just after they've had their babies, which is really interesting. And then I work with Girls Gone Strong. So I kind of have a lot of things going on, which suits me because I love variety in my work. So, but I've come very much, I guess, from a traditional musculoskeletal physiotherapy background. So I used to work with sore backs, sore knees, the usual sports injuries. And then I had children and thought, what the hell? I didn't know any of this stuff. And yeah, it kind of led me down a path with my own recovery. And I had great pregnancies and births, but I still was really quite surprised at how much my body had changed. Mm-hmm. And it really kind of shocked me, I guess. And so my children are 10 and 12 now. But just through that process, I thought, well, if I didn't know this, and I'm a physio, that's pretty bad. So how much does the general population know about, what changes in their body through pregnancy and childbirth and recovery? So that's kind of, I guess, where my passion comes from.
No, absolutely. I know it's something that I haven't been in the fitness industry quite as long as Molly, but I've been a trainer coming up on 16 years in a few more months, and I would not say I'm proud of the level of knowledge I have about, like training someone who is pregnant. And I have absolutely had friends and colleagues who have come to me and said, like, hey, Eric, I'm pregnant, or my friend is. You got any advice on what they should do, resistance training wise? And my answer is always like, let me get back to you while I voraciously Google search because it's just not in the standard education. And I think that's probably a problem. The more I think about it. So there's a fair number of women on the planet. Apparently the sperm decides you guys are pretty important. So and it's a pretty decent chance on like that a fair number of women will be pregnant at some point in their life. So I would not be surprised if there weren't a number of listeners on Iron Culture who might find themselves having the exact same experience, either as a trainer or for themselves. So I guess first step is let's talk about what are some of the changes that actually occurs going through the various stages of pregnancy, and then even in the phases after that, physiologically, that people should have a good kind of general understanding of.
So, I mean, if we look through the different systems, I mean, just even from a cardiovascular point of view, I think people underestimate the changes there. Even in the first trimester, you have this increase in blood volume of like 40%. So your heart is working harder. And that's why a lot of women, even when their baby is so tiny, it's like the size of a bean, you'll try and run and be like, why am I so breathless? Like, why is this so damn hard? Like, I look exactly the same. Nothing has changed. But you are already working harder in that first trimester. So we've got lots of changes to the cardiovascular system. Through the pregnancy, obviously that increases even more. The respiratory system, we've got changes in the rib positioning. So our ribs, our infrasternal angle. Sorry, for those who are listening on the podcast, I am doing funny things with my hands right now. But the infrasternal angle changes from being quite acute to being sort of, a larger angle. So our diaphragm kind of gets shoved up and our rib angles change. So that'll affect our breathing as well. And then obviously there's metabolic changes as our body is trying to produce a baby. And then there's a lot through the musculoskeletal system as well. So our abdominal wall has to stretch to grow the baby, and that is normal. And we talk a lot about diastasis recti in the program because that's something that I think a lot of people freak out about, and that is the linea alba, which connects the two sides of the abdominal wall, has to actually thin and stretch as our belly gets bigger. And that is a normal part of growing a baby, right? So there's that, and our abdominal wall can't generate as much force because it's obviously in a more lengthened position. We have changes in the pelvic floor as well. So the pelvic floor muscles, which for those that are listening that have never heard of that term, are the muscles that sit at the base of the pelvis. They connect the pubic bone at the front, the coccyx at the back, and your ischial tuberosities, so the bony bits underneath your butt. So it's like a big sort of diamond-shaped muscle group, and they basically hold everything inside, but they also give us control over our bladder and bowel. So those muscles will obviously cop a bit of load from the weight of the baby and the placenta and the fluid. So there's changes through the pelvic floor as well. And then there's, we could probably go on and on, but I think that sort of will give you a bit of a gist as to some of the main changes that occurred during pregnancy. And I'm sure Molly has got a few to add in there.
Well, it sounds like a fantastic pelvic floor hypertrophy program to start. So I think that's something worth considering for your marketing team, but I'll leave that one for free for you guys to take where you will. But Molly, I'd love to hear you.
We don't necessarily recommend women get pregnant just to get stronger vaginal muscles, but you can use cones and weights and there are vaginal barbells, by the way.
Okay, that A is amazing. B, I think we should consider being part of your affiliate program, but again, we'll talk off air. That's awesome.
So I would love, Marika did a fantastic job of kind of covering the high level stuff. So what I'd love to do, if you're okay with it, or really I don't care if you're okay with it because I think it just makes sense. We should actually dive into what that means for training during pregnancy, right? And I'm going to kind of stay mostly on the strength training side of things. I heard you all are a little bit interested in strength training. So I think that might, or at least you want to be interested. So I don't know if you do it much, but you're interested in being interested in it. So, okay. Cool. So we'll start with strength training during pregnancy. So there are two really big myths that are things that you all have probably heard. Like you said, there's very little information about strength training during pregnancy in most kind of general curriculum, whether that's just certification or you're taking you're getting your exercise science degree or kinesiology. And the frustrating thing, it's less that there's not a lot of information about it because it truly does need to be a separate kind of certification or education, right? We wrote a 500-page textbook on it, but they don't even tell you that it's a big deal, that it's something you should learn about, right? It's like, they don't even say like, we can't cover this here, but we really highly recommend that you learn more about this, because 67 to 75% of people who hire a coach or trainer are women, and 85% of women, at least in the US, will have a baby at some point in their life. So if you work with women, you're likely working with women who will become pregnant or have been pregnant at some point in their life. So the two biggest myths about strength training during pregnancy are that you can't start anything new in pregnancy, and that you should just keep doing what you were doing prior to pregnancy. So those are kind of the blanket recommendations that people hear, but both of those are not like fully true recommendations, right? So first things first, you can't start anything new in pregnancy. That's actually incorrect. So it's really important that all women get screened by their healthcare professional to make sure that they don't have any absolute or relative contraindications to training during pregnancy. But once a woman is cleared, even if she wasn't active prior to pregnancy, she can, and it's recommended that she start being active in pregnancy. So all the major governing bodies recommend a minimum of 150 minutes of exercise per week, spread over at least 3 days, and that's a combination of cardiovascular exercise and strength training exercise. Now, the caveat is that she should start exercising at low intensities and then work her way up to exercising at moderate intensities. And so that's both intensity of effort and intensity of load. So starting maybe in like the kind of 4 out of 10 like RPE range, or perceived effort range, in terms of both cardiovascular exercise and strength training. And then she can work her way up over time as she gets stronger, as her body adapts, to closer to like a 6 or 7 out of 10 on both intensity of effort and intensity of load. She shouldn't go over the 7. And obviously it's really important that she kind of listens to her body, but brand new trainees can still get newbie gains in pregnancy, which is amazing. They can actually get stronger and gain muscle even if they start strength training in pregnancy and hadn't strength trained before. So that's pretty cool. In terms of keep doing what you were doing prior to pregnancy, there are actually a number of things that women can do outside of pregnancy that are contraindicated in pregnancy. One of the most important is going to be high intensity interval training. So we know people call things HIIT all the time, right? They throw around HIIT all the time, just like do this for 3 minutes and whatever. We're talking like working at the near maximal range of a 9.5 to 10 out of 10 on the perceived effort scale or rate of perceived exertion during your work periods. So that is contraindicated in pregnancy, no matter how fit you were prior to pregnancy. So they don't recommend going above about an 8.5 out of 10 on the perceived effort scale, and that is only if you were doing that prior to pregnancy. So HIIT is contraindicated. Believe it or not, contact sports are contraindicated. I don't know why they're trying to take away all the fun stuff like rugby and hockey and that kind of thing. Anything with a high risk of falling, so horseback riding, things like that, contraindicated. Anything done in really high temperatures, anything done at high altitudes if you don't live at a high altitude. So they define high altitude as around 8,200 feet, around 2,500 meters. So don't exercise at that altitude unless you were doing it previously. And if you want to, you're supposed to do it under the care of your doctor. Then let's see, I'm trying to think of other general recommendations. Some newer guidelines are the Valsalva maneuver. There's kind of some, like, I wouldn't say controversy around it, but some experts say it's okay. Some say it might not be okay. The thing is with the Valsalva maneuver, you're typically doing that when you're trying to lift as heavy as possible. And something that you're using when you're lifting in much higher percentage or intensity, higher percent of your 1 rep max, which isn't recommended in pregnancy either. And we can talk about why there's not a lot of research about that in a little bit, but that's not recommended because it can not only increase blood pressure, but it can increase pressure, downward pressure on the pelvic floor, like Marika was talking about, that's already dealing with more stress. And then Olympic lifting. So this was a new guideline, I think, that came out maybe the beginning of 2019. Barbell Olympic lifting is not recommended past the first trimester because of risk of fetal impact. So as the bar passes over the belly, it could potentially hit the growing belly, and or if the mother is trying to change the way that she's lifting to avoid her belly, then she increases her risk of injury as well. Marika, anything I left off in terms of, then things kind of change trimester to trimester, but in terms of general stuff, Those are things that if you were doing them prior to pregnancy, they are still, that you shouldn't be doing them in pregnancy.
Anything to add, Marika?
No, I think that was an awesome list, Molly. I just in terms of all the contraindications, and they're all listed and they're easy to access. So if you have trainers who are thinking, oh, I don't know if this is right, the Canadian guidelines, which Molly said came out technically they came out end of 2018, but I think they're called the 2019 guidelines. They're the most up to date and very evidence based on lots of RCT. So they're a really good article to go and access. And if you're working with a really elite sport, the BJSM article, which was done by the International Olympic Committee as well, just for those people who really, really do work with the elite level athletes. And again, there's not a ton of research on that stuff. And Molly and I have talked about this before, but, people will say, well, is it okay to lift really, really heavy? Is it okay to do this? And the reality is we don't have data because ethics approval is really freaking hard to do. It's really hard to do anything in pregnancy. I can tell you this right now. We're trying to do studies and stuff, and they're like, don't touch pregnancy. Don't even go there. It'll take you 2 years to even get approval for anything, let alone something that could be considered risky for mum or baby. So it's really hard to get data. But the Valsalva side of things, because it can cause an increase in blood pressure, a spike in blood pressure, that's where the concern is with a cardiovascular system that's already, working really hard, and whether that will impact on the blood flow to the baby. And then also, as Molly mentioned, the Valsalva, massive increase in intra-abdominal pressure. Do we want to put that much strain on the pelvic floor and abdominal wall? And these are just things, I think, just to be really aware of. And the high intensity, getting the heart rate really up high. Again, there has been some study actually with elite athletes, and there does seem to be like a transient drop in blood flow to the baby. And it seems to come back. But that's where if people really want to be working at that, if you've got an elite level runner, they should be under a care of a team where they're constantly supervised if they want to work at those levels of intensity, because we just don't have the information to say that it's perfectly safe. It seems to be okay, but we would always recommend closer supervision for those people. But for the general public, using, like Molly said, the RP is great, and that works really well clinically for most of us. And we've always been of the opinion, and this is totally based in science, that, my God, we just got to keep women exercising during pregnancy, because, when you look at the recommendations, so 150 minutes a week plus 2 strength training sessions, do you want to hazard a guess as to how many women actually meet those guidelines?
I would guess probably something around 10, 20% at most.
Yeah, 15%. So you're awesome. I'm going to send you a little prize.
Yes.
Gold star next to the name.
To be honest, the main reason I compete in multiple sports that often have 1 or 2 people in my weight class, age division, and all that is so I can get little prizes. I have considered just making a sport out of going to trophy shops and buying things. But still working on how to make that one sell on the gram. Say again? What
little person do you want on the top of your trophy, though?
Oh, well, I guess on this one it would be like a statistician, like to someone who just looks intelligent. I want it to be specific to the sport. The sport of hazarding guesses at stats that are reasonably close to accurate.
Like a magic 8-ball kind of.
Well, that assumes I guessed instead of having some kind of secret knowledge that makes my ego feel better. So
it was a very good educated guess, Eric. But
Thank you.
15%. So I think we're always trying to figure out ways to keep women exercising as long as possible. And for those of you, and I know your listeners are really big on strength training, there's actually been really good research to show that when you add strength training to aerobic training, the women get better results in pregnancy.
Very cool.
Strength training alone there's not a lot of evidence, doesn't seem to be anything standing out as being particularly superior. But when you add strength training to aerobic training, women tend to have better fitness, less incontinence, better, less excessive weight gain, reduced risk of gestational diabetes. So there does seem to be benefits. And I think for people who always are thinking, I better go and do some swimming and maybe some Pilates, or just go and do yoga, I better stop everything. It's like, we want women to strength train. And what I see clinically is that motherhood is really freaking hard. Like you're lifting, you're carrying, you're getting prams in and out, what do you call them? Strollers in and out of the car, and the car seats out, and it's like physically hard work. And I came from, when I first started teaching exercise classes in pregnancy, I was really conservative and really gentle and just body weight things and little pathetic pink weights. And then I realized, like, oh my God, I'm not preparing these women for motherhood. And I had to just completely change the way that I worked with pregnant women. And they work a lot harder in terms of strength training with me now than they did 10 years ago.
It makes sense. I mean, when you described, sorry, go ahead.
I was just going to say Marika has to consistently show up. Like if we've got Facebook posts or like things running that have photos of a pregnant woman, like trap bar deadlifting, for example, which in a minute we'll get into what you can do in pregnancy because we've talked a lot about what you can't. But, you know, it'll be a woman. The woman is actually, her name is Amanda Graydon. She happens to be married to a gentleman named Dr. John Berardi. She is incredibly strong and fit, has 4 children, and she's deadlifting like 40% of her 1 rep max maybe. With a trap bar, and people are like, especially physios are on there freaking out going, this is not safe, I can't believe you're doing it. And Marika has to often show up there and drop a little knowledge for people. But that's kind of the way the pendulum is, you know, swung a little bit, at least. And a lot of people are still stuck in that women should only walk and stretch and, you know, do yoga or Pilates.
I mean, it makes a lot of sense when you think about the physiological adaptations that you described to kick this off, Marika. Like basically your life RPE goes up, you know, you're getting these cardiovascular adaptations preparing you for carrying a baby to term, and you're carrying more weight, and also that's compounded by being told by the traditional kind of guidelines of do less. So now you're feeling more tired and you're doing less. I could easily see someone who doesn't purposely do aerobic training, and in addition to strength training, of course, having some poor adaptations and getting detrained during pregnancy and having a tougher rebound for sure. So it makes a lot of sense to me. It's also very interesting that when the mother does high intensity exercise, you see blood shunted away from the fetus. That makes me think from almost a evolutionary evolutionary kind of biology perspective. Like obviously the baby can't be carried to term if the mother can't escape the tiger. Which is the example I always use is that I got in my online degree from my knowledge of this topic. So it's really cool to me when you think about it from like a survival perspective, and I would say a lot of our listeners are probably going to be really pleased to hear this. I know when you post about this online, people in the more general public are maybe taken aback and like, oh, I'm allowed to do that. I'm encouraged to do that. But I've heard this and it maybe seemed to be counter to it. I would guess that a lot of the Iron Culture listeners, their bias would be, I want to find the thing that tells me I'm allowed to still lift heavy and hard. So you're preaching the good news to everyone who's listening, I'm sure. And I guess I have some, and as you alluded to, Molly, we can get into kind of the pragmatic tactical stuff, what movements work well. Obviously it makes sense, like a clean or a snatch. There's going to be a barrier that is the protective covering of a baby that you shouldn't be smashing barbells into. But okay, sweet, trap bar deadlift. Now I have a way to still keep it over my center of gravity. So my question is to first kick off that kind of direction is, so the Valsalva thing, it makes sense. You know, obviously you take a big deep breath, you hold it while you lift. It drives up blood pressure, increases intra-abdominal pressure. But it's also, you could argue, you know, a safety thing. That if you don't create a rigid core transferring, you know, that force, you can get out of position. You can fail a lift that you might not otherwise have. I know for me, I think about, and I don't know about you, Omar, like if I was to get underneath a front squat or a back squat or pull a reasonably heavy deadlift and not take a big deep breath and hold it, I think that'd be very difficult to make my body even do that. Is that a challenge you guys have had when you're taking maybe a strength athlete who is modifying the way they train during pregnancy, or how do you coach around that? Or is it they breathe inward during the lifting phase and then breathe out, so it's not a true sustained Valsalva? What does that look like?
Marika, you want to take that one and then I'll jump in?
Yeah, for a lot of people, that's going to come down to load management, and you're right. You know, I just don't work. I don't want people doing the really low rep maxes, because from a safety perspective, and as you said, you can't really do it. You can't do it without a Valsalva. You can't do it without a breath hold. And so a big part of that is just changing the rep ranges and just getting them into that sort of 10 to 12 rep range. And
the hypertrophy program, folks, that pregnancy is. I love it.
Exactly. And that can be hard, I think, sort of psychologically for some people, depending on what their goals are and what they've traditionally trained with. We often sort of, that's going to involve a lot of from your coaching skills, and I think Molly will talk more to that in a minute, is about changing some of the goal settings, saying, look, we're not going to be working the really the big power stuff through the pregnancy. We're looking at maintaining. We're looking at trying to reduce loss of the gains that you've made up to this point. We want to keep you moving. We want to keep you strong. But ideally, if you just change those rep ranges, you should be able to do like an exhale on exertion or something like that, where you're not going to have so much intra-abdominal pressure. So that's the way that I look at it. Molly?
Yeah, that can be really hard. And, one thing that we try to champion at Girls Gone Strong as much as possible is body autonomy. So especially during pregnancy, women often have a lost feeling like their body doesn't belong to them, or everyone's telling them what to do. And so we try to take the path of kind of educating them on maybe what some of the risks, risk to benefit of doing that type of stuff is. And for most high level athletes, it is kind of a difficult transition, a little bit of an identity loss, maybe even, but helping them understand that it is going to, that there are some risks to it that may hinder their ability to recover as quickly or lengthen the amount of time that they have in their postpartum recovery before they can then return to the activities they love is often a really useful piece of information. So we want to educate them and then kind of work with them to make those decisions. Like Marika said, she often recommends kind of that 10 to 12 rep range. We have a little broader rep range that we recommend in our certifications and programs, which is in that like kind of 6 to 15, but that 6 rep max or 6 reps is not a 6 rep max, right? You'll be lifting, it'd be a weight that you could lift for maybe 8 to 9 reps, something like that. So they can stay relatively strong. It's just kind of like, what's the benefit of this given the risk level of like the pelvic floor dysfunction that they might experience or things like that. So that's kind of, and again, there's no magic rep range because we haven't done the research on, what happens when a woman lifts her, 1 rep max in pregnancy or even 3 rep max. So that 6 to 15 rep range with a couple reps in the tank, we found to work really well for most women. But again, explaining to them like how it might affect postpartum recovery time for people who want to get back to it after pregnancy is a really powerful way to kind of help them make that decision in terms of like what they want to do and how heavy they want to lift during pregnancy.
Makes a lot of sense to me. Omar, I was actually thinking this could be part of a periodization plan. So you get pregnant, you just signed up for a 9-month hypertrophy block. And also, let's think of it this way, right? So you've got this baby who is absolutely crushing it in terms of hypertrophy. Mm-hmm. I mean, most successful gaining phase you'll ever see. I went from not existing or to just being visible on like the cellular level to I weigh 9 pounds solid, well, like baby solid, but still there's a lot more cross-sectional area going on there. If we pitch it as, hey, do you want to let your baby get bigger than you, like make better gains? It's your time to compete with this baby. Because honestly, our society operates on a meritocracy. It's all about competition. Mm-hmm. It's what makes people better. And it's what makes societies better. Mm-hmm. This is one of those times we're not critiquing capitalism. So I think we pitch it as a hypertrophy program where your goal is to beat your baby. Omar, what do you think?
Yeah. And we would just phrase it, there's something growing inside of you that wants to be better than you. Are you going to let that happen? And can I just say that initially there was trepidation on my part before doing this episode. One, because largely I learned my prior information, pregnancy information from the Arnold Classic Junior, which I told was not scientifically validated. Okay. But 2, and this is a true story, at the tail
Great
end
movie, by the way.
Him and Danny DeVito, name a better iconic comedic duo. Arnold's timing, is
Twins.
it bad? Yeah. Is it bad
Yep.
acting, or is that him actually trying to deliver the lines faithfully? Who knows, right? And then this is true that at the tail end of my training career, Greg Knuckles was actually putting out some fire information when it came to training differences between men and women, how there actually isn't that many, like really championing a lot of very good causes, talking about women training through menopause, a lot of different things. And for him to have his then mind blown, I'm like, Greg, I trusted your ass. Like, what's going on here? So to know that he was a false prophet and that's what I was following this entire time, whew, that's a hard pill to swallow. But I do want, Eric, just quickly before we go on, well, the TikTok crew is not sabotaging my internet connection because it's now not lagging and I could just ask it. I would want a pitch, the elevator pitch from both Molly and Marika, in order to talk to those that might not be training yet and those that might then become pregnant and they want to understand the novel benefits, because I do think it's absolutely true. I think whatever, like let's say 80-90% of our audience is definitely probably lifting, but there's probably people lifting with a lifting who have significant others who might not be lifting, who might be pregnant, or that might be something on the horizon. And so we want to include them as well. If you can give just the elevator pitch, I don't know who wants to start. It's like, okay, so I'm now pregnant. I haven't lifted before. Should I start lifting? And I think all too often, not in this segment right here, there's some of that risk aversion, fear aversion, right? Like, I don't know if I should do that. And so we're speaking kind of in group, but let's just suppose there's maybe a 5% portion of the audience that is on the fence. Let's hear that pitch, because we're the bias to what we're saying. Yes, it's a go. The hypertrophy part, it's a go. So let's bring everyone in there.
Yes, absolutely. So if you were not strength training prior to pregnancy and doing cardiovascular exercise prior to pregnancy, we highly recommend it for a number of reasons. Not only are you going to gain strength, not only are you going to gain muscle mass, not only are you going to decrease your risk and severity of urinary incontinence, you're going to get stronger bones. You're going to likely have an easier labor and delivery, prepare your body for labor and delivery. There's some evidence to suggest you may have decreased postpartum recovery time, and it's going to help you manage your mental health better, and it's going to make you really freaking awesome. And jacked.
I'm sold. And you know what? I don't know who else has experienced this. Maybe I just have a mother who really likes to guilt trip me. But I always, anytime, and I'm 37, and my mom's over, and she's, I swear to God, I'm more than half her age now. She's just turned 70. Bless her heart. And when she wants to make me feel bad, she'll still bring up the fact that I was in labor for a long time and I had to bring out the forceps on me. And yes. And oh no, I think it was the suction cup. So I had the suction cup. So I had the cone head when I came out. I'm sure that didn't damage my mental faculties at all. And she talks about how long it took, how much pain she was in. And I'm sitting there, I'm like, I wasn't even forming memories. I don't understand why you bring this up, but okay, you got me. I'm a bad person.
I had no agency, please.
Yeah, correct. I definitely chose to be birthed that way. I think we should flip the script. And instead, anytime the child starts to challenge the mother, they go, you know what? I gave birth to you in 10 minutes and it was easy. I squeezed you out with that hypertrophied pelvic floor. You were nothing. You were a little weak child and I grew more muscle mass than you even grew. I think that's the new change. You step up, I squeeze you out, I can squeeze you to death if I need to. Got your ass.
So I will let Marika in just a moment clear up the misinformation about the pelvic floor related to birth that you just said. But
Perfect.
Really quickly, I did want to say also it reduces, like Marika said earlier, reduces risk of gestational diabetes. So if a woman develops gestational diabetes, and also when you have gestational diabetes, you have bigger, harder to deliver babies often. And so when a woman has gestational diabetes in pregnancy, she has a 69% chance of developing it in subsequent pregnancies, and a 6 times increased risk of developing type 2 diabetes outside of pregnancy. So we all know that is not a good thing. So strength training and doing cardiovascular exercise during pregnancy can help with that as well.
And exercise in general will help reduce your risk of preeclampsia, which is when you have a really significantly large increase in blood pressure and protein in the urine, and it's really, really scary. I saw a lady on the ward yesterday pretty much stroked out. Like, it's really scary stuff. So again, exercise might help prevent you from having really serious pregnancy complications.
Now, there does seem to be a trade-off here. You talked about avoiding having really big babies. Now, Omar, I don't know about you, but I'm thinking of how are we going to usher in the new era of mass monsters? And I think if you need to get to 300 pounds on stage shredded, you got to get an early start. So Pros, cons, am I wrong here?
Wait for the toddler age, like maybe not in utero.
I mean, yeah, we can do that, but you know what they're going to be doing over in the Eastern Bloc countries? They're going to have a few years on us, And I think by good old fashioned, pulling ourselves by our bootstraps, we can catch up, just like we did in the '80s in that famous documentary Rocky IV. We showed how we can overcome the communist threat with hard work, training in the snow in a log cabin, if we need to with our toddlers. So
Our friend
I'm
might
okay with
die.
that.
Yeah, but the sacrifice was worth it.
Absolutely.
And like you said, like if we can convince the women to get more jacked, they don't want their baby to get more jacked than them. So it's like, hey, if you exercise and lift, like not only are you going to get more jacked, but then your baby's not going to be able to get more jacked than you because you're not going to have this big of a baby. I just feel like we're just making magic here.
I think there's and you know what? Everyone loves an underdog. We don't want you coming out of the womb already, Mr. or Miss Olympia. We want you to we need a chip on the shoulder.
Scrawny, yeah.
Absolutely. We're talking classic, old school, you got kicked sand in the face on the beach,
Charles
significant
Atlas.
others
Yep.
taken away. You better go train and come back. And we need that sand in your eye as soon as you come out of the womb. Like you're weak, your mother stole your gains and you need to bring that back. And I just heard from our TikTok crew we're reconnecting for the Out Alpha tour on our current topic. So thank you very much. They're trending upwards now. So I appreciate that. All right. In all seriousness,
Can we talk about the childbirth side of things for a sec?
100%.
Yes. Hold on, Marie. Are we gonna talk about changes each trimester real quick? I feel like we can maybe do a logical. Or are you gonna correct Eric being wrong about the pelvic floor and childbirth and how that works?
We can. No, you know what, Molly? You do run the pregnancy trimester by trimester because then.
Molly, just real quick, I have to say, in defense of my boy Eric, I think you misheard what he said. He did not say pelvic floor. Sometimes when we do these interviews, the audio gets scrambled. I think he said pelvic bore, and he was talking to me about one of my poses that I did. So that was an unrelated topic. But for if someone assumes
For education, if
for
they also
educational
misheard
purposes.
Got it. Yeah. Then we'll let Marie correct it. Okay.
It was
Okay. Well,
placenta, but it was in a different language, wasn't it? Yeah.
I don't know what language because I don't know who's listening, but probably. Yeah. That's right.
Uterus.
okay. So we'll talk about changes per trimester. So I don't know if you know this, but pregnancy happens in a logical sequence, starting with conception all the way up to 40 to 42 weeks. So there's three, and that's the thing. People say pregnancy is 9 months. It's not 9 months. It's 40 to 42 weeks. Sometimes I guess people give birth a little bit earlier than 40 weeks, but first trimester is generally considered from week 1 to about week 13 or 14. Second trimester is generally considered week 13 or 14 to about 27 or 28. And then the third trimester is considered, or 27 or 28, and then 27 or 28 on is generally considered the third trimester. So first trimester, beyond all of the things that we said not to do, so no contact sports, no exercising in really high temperatures, no Valsalva maneuver, no high intensity interval training, so training at that 9.5 to 10, things like that. Then first trimester is pretty much the same. So your clients, and all throughout pregnancy, technically, they can squat, they can hinge, they can push, they can pull, they can lunge, they can carry, they can do all of those strength training exercises. They just might be modified based on how they're feeling, what their ability level is, and what their experience with lifting is, and how they feel throughout pregnancy, and then how their body changes. So trimester 1, if your client was barbell back squatting prior to pregnancy, she can probably continue doing that in pregnancy. If she has never barbell back squatted before, she might start with a bodyweight squat or a dumbbell squat or a goblet squat or even like a light front squat, something like that. So the good thing is the general intelligent principles of strength and conditioning still apply in pregnancy, right? It's not like everything goes out the window. So you'd start your client with an exercise that they're comfortable with, that they feel good with, that is within their ability level, right? So trimester 1, beyond like feeling kind of tired and nauseous, not a whole lot is changing in terms of her training program in trimester 1. So she can generally continue doing what she was doing prior to pregnancy. Again, staying in that kind of 6 to 15 rep range. In trimester 2 is when some things start to change. That's when her belly's going to grow a little bit bigger. There's a lot of question about whether or not it's okay for a woman to lie on her back during pregnancy. And this kind of question is posed around the second trimester. So anytime between like week 16 and week 28. So there's a lot of discussion, a little bit of controversy about it. Some people say a woman should never lie on her back after 16 weeks of pregnancy. Some people say it's totally fine up to 28 weeks. Some people say it's totally fine as long as she's not experiencing dizziness, tingling in her legs and feet, lightheadedness, nausea, things like that. So the idea is that when she's lying on her back, the baby is pressing on her vena cava and reducing blood flow. But evidence shows that when a woman's exercising on her back, the blood flow only reduces by about 50%. And so they say it's okay for her to lie on her back for short bouts of time. But as far as I know, short bouts is not clearly defined. So it's, I mean, probably anybody's guess, 30 to 90 seconds.
One set of bench press.
Yeah, exactly. The other thing is that women lie on their backs all the time on exam tables. And women roll to their back when they're sleeping as well. So it's one of those things where it's like, it probably makes sense. Listen to your body, like have your client, like make sure she's, monitoring for symptoms. And if you want to alleviate the concern altogether, all she has to do is elevate her back by about 15%. So it's something worth noting. It's something worth paying attention to. As your client hits, further along in her second trimester, you can let her know if she's uncomfortable on her back or experiences any of those symptoms. You can either elevate her or just, help her elevate her back a little bit, or have her shorten the amount of time she's doing the exercise, or do a different exercise altogether. As the belly grows as well, it might start, she might start feeling like she's having some coning or some doming in her linea alba. Marika, I'll probably let you cover that a little bit, but that's when, as the rectus abdominis muscles separate and the linea alba thins, the linea alba will kind of cone or dome or kind of stick out a little bit. There's no evidence to suggest that specific exercises in pregnancy make diastasis recti worse. However, we kind of think that it makes sense at Girls Gone Strong, after a lot of discussion, to not put a whole lot of excess pressure or stress on the linea alba as it's already stretching and thinning. So you might take a plank and move it to an incline plank, or a push-up and move it to an incline push-up, paying close attention to how the linea alba is handling the intra-abdominal pressure. So it's kind of like the weakest link, right, in the chain. Right. So like in her trunk or her core, if she's having pelvic floor symptoms, if you're seeing this doming or coning in the linea alba, it might be that she can't manage that intra-abdominal pressure. She can't create the tension that she needs to create in the linea alba to be able to do the exercise that she's doing at the level that she's doing it. So that's second trimester. So pay attention to any pelvic floor symptoms. Pay attention to anything where she's feeling excess pressure or downward pressure on her pelvic floor. So if she's having pelvic pain, urinary incontinence, if she's noticing that she's having low back pain, if she feels like something is kind of bulging or something's even kind of starting to fall out, that's a really common sensation for women who are having pelvic floor dysfunction, then she might want to back the exercise down a little bit. And again, general principles of strength and conditioning apply. She can reduce the load. She can reduce the number of reps, but maintain the same load in case she's fatiguing. She can rest more. She can change her foot position. She can change the type of implement she's using, maybe from a barbell to a trap bar. There are a number of things that she can do that you can help your client do to make the exercise a little bit easier and see if she can tolerate it a little bit better. And then in third trimester, same kind of thing. The belly's going to be a lot bigger. So not only might she feel more downward pressure on her pelvic floor, but logistically, sometimes it can kind of get in the way a little bit. So some women might find something like a Romanian deadlift kind of tough, as their belly runs into their thighs when they start to hinge back. So they might do better with a trap bar deadlift, or it might do better if you elevate. She's doing like a double suitcase deadlift or something like that with kettlebells, elevate them a little bit. And then again, obviously she's not going to be doing exercises laying on her belly in second and third trimester, because that's going to going to get in the way. And then she might find that she gets a little bit more tired in the third trimester as well. Second trimester tends to be where women feel their best. Their belly isn't that big yet. They have often more energy and less nausea than they did in the first trimester, but they're not all the way to the third trimester yet, where their body's really working extra hard and they're carrying a lot of extra weight. Did I miss anything, Marika, in terms of modifying?
A couple of things I was just jotting down was sometimes balance is an issue. So women you're something like 2 or 3 times more likely to fall during pregnancy because of probably the changes in the center of gravity and, probably some of the muscular changes too. So women are more vulnerable. So I'd be really careful about things like, for example, box jumps. Maybe don't do that. And a lot of, I just recall falling down a flight of stairs while being 38 weeks pregnant. It's easy to do. It was not on my butt. It hurt a lot. But yeah, just be careful, I think, with anything that's like really complex in terms of balance requirements. And the other thing too is that because you can get blood pressure changes pretty rapidly in pregnancy, especially coming up from sitting or coming up from lying or sitting. So just probably limit the number of changes of position. So, I would tend to do a lot of standing exercises and then move on to sitting or lying or whatever. But I wouldn't get a pregnant woman in a final trimester doing a standing exercise and then a lying exercise and then a standing exercise and a lying, because that they can start to feel a little bit off, a little bit dizzy when they come up and down so much.
Makes sense. So I think these are really helpful principles, because I think if someone is an Olympic lifter or a power lifter, or if they're in a specific strength sport, they can start to understand like what makes sense. Like, okay, I'm an Olympic lifter. I can do, front squats. I can do some, trap bar deadlifts for kind of general strength. And then I can do a lot of, higher rep, but moderate RPE pressing from, say, high blocks. If I'm a power lifter, cool. I can still bench if I can, if it's not causing me any issues. Maybe I have to limit the reps per set. I can still do back squats, trap bar deadlifts. You can at the very least expect to hold on to a whole hell of a lot more strength than not training. Omar, this kind of reminds me when we were talking about the lockdowns and how it's very easy to get, fatalistic when you have a really kind of hard driving athlete mentality. Like, well, if I can't train optimally, what's the point? And I think most people logically know that doesn't make any sense. The kind of thing like I got a flat tire, might as well knife them all, We don't logically think that, but I think emotionally that's a very easy place to go. Whether that's with nutrition, whether that's with training, or whether that's with life circumstances, be that COVID or be that pregnancy. So I think, is that something that you guys have faced psychologically when working with women who are going through pregnancy, is trying to shift their perspective towards, changing optimal or best or what's reasonable to within the new constraints of their life rather than where they were prior?
Yeah, absolutely. I think in kind of the all or nothing mentality is so common for people, and especially high level athletes feel like if I can't do it all the way, then what's the point, right? Or they often compare themselves to what they used to be able to do. And so, yes, psychologically, it's definitely a big kind of thing that coaches need to be aware of, and that people who have trained at previously high intensities need to be aware of, that doing something is significantly better than doing nothing. And again, taking it back to, if you do something during pregnancy, if you, are still lifting, but just maybe doing things a little bit modified, not only are you going to probably recover more quickly, but you'll be able to get back to the activities that you love more quickly. Because, we always say once postpartum, always postpartum. And that's a phrase that is really important, but can also kind of upset people a little bit, because they think that it means that once a woman's had a baby, that she's fragile or she can't get back to the activities that she loves. But the thing is pregnant women and postpartum women are neither fragile nor bulletproof, right? And so it's really important for her to recognize it's very possible that she can get back to all the activities that she loves that she was doing prior to pregnancy, and maybe even be stronger, faster, more explosive, perform at a higher level than she did prior to pregnancy. But taking good care of her body during pregnancy is going to increase the chance of her being able to do that, which is really important. But then the once postpartum, always postpartum is important, because a lot of women say, I want my pre-baby body back, right? I want to get back to how it was prior to pregnancy. But that's like having knee surgery and be like, I want to have my knee prior to surgery back, right? Your body has been through some really intense anatomical and physiological changes And so it's important to recognize that you aren't going to have your pre-surgery knee, right? You're not going to have the same pre-baby body, but that doesn't mean that you can't get back to a really high level of intense activity that you enjoy, and even be stronger, faster, more explosive, higher performing than you were prior to pregnancy.
100%. Totally makes sense. So, you slowed us down, Molly, and you brought us back on track. That's never a problem with Iron Culture. As you can tell, we always follow a logical flow and answer all questions in order. So I think, Marika, you were going to take us into the actual giving birth and that phase. Is that where we were going?
Yeah, we were. Yeah, absolutely. So you mentioned something before, and I'm not. It was actually a really good analogy. You were talking about the tiger, and you were saying, our and you were using it in a different way, but I use a similar analogy for childbirth, because we talk about oxytocin levels, and we need to be, when we're giving birth, in a space. If you want to give birth naturally without drugs, you need to be feeling safe, protected, private. We need all these things in place, which actually help our oxytocin levels to rise, because as our oxytocin levels rise, that helps things to open up and the uterus to get ready to push out the baby. I'm making funny hand actions again.
I imagined uterus pushing out the baby.
I don't even know how to describe this wave of contraction.
It's kind of peristalsis. Yeah, I like that. Yeah.
Exactly. Yeah. So when women in labor have fear, so when we have fear, we have adrenaline rising. We get spikes in adrenaline. It actually shuts down the oxytocin rise and slows down the labor. And it just made me think of that, because I use that analogy a lot, because it makes sense that if you were being chased by a saber-toothed tiger, it's not a good time to push out a baby. So that's just going to shut everything down. So when women are in labor, they want to feel like they're completely safe, relaxed, safe from predators, so that their oxytocin levels can rise so they can push out a baby. Totally irrelevant, really, to what we were saying, but it just reminded me of that. In terms...
No, it's important. So you heard it here first, folks. If there are saber-toothed tigers in your house, get them out before you give birth. Just get those oxytocin levels in order. Carry on.
Exactly. When it comes to childbirth, obviously there's pretty much two ways to get a baby out, right? You either have a vaginal birth or you have a C-section. So it either comes out the bottom or it comes out through we've talked about the sky, the roof, rooftop. Anyway, so you have a C-section or you have a vaginal birth. Some women are kind of blessed to almost have both, where they go through a really long, drawn-out birth process and then they go on to have a C-section. So they can almost have, the difficulties of both kind of births. But I think what we kind of want people to understand is that the birth process itself and the recovery period can have a big impact on the recovery process. So if someone had a vaginal birth that was really simple, she had minimal tearing, and we can talk about that in a bit, she didn't have any post-birth complications, she might get back to exercise pretty quickly, and she might be able to kind of progress through her stages of rehab pretty quickly. Versus somebody who maybe had a more traumatic birth, who had a baby with a big head, I'm not looking at anyone in particular, where maybe the forceps came in. So the forceps, they basically look like big salad servers, right? And they come around and basically assist in the delivery of the baby. Now, I've had some ladies recently who said the doctor had their foot on the bed, pulling, Eric is like wriggling in his chair, looking very uncomfortable. Every woman is feeling very uncomfortable right now. So you can imagine, in terms of the recovery from that, because there can be quite a lot of damage to the pelvic floor, to the perineum, that person is probably going to take a longer period of time to recover. And we know statistically that if someone has a forceps birth, they have a much, much higher risk of prolapse, and they have a much higher risk of what we call a levator avulsion, which is literally where part of the pelvic floor gets torn away from the bone. Okay. So we kind of need to be aware of these things. And I think from a coach or trainer, that's coming down to your screening process. So you really need to, if you're working with postnatal women, and we can talk about this again later about how you can have these conversations, but we kind of want to know, like, what was your birth like? How's your recovery been? Did she have a massive hemorrhage afterwards? Because I had a woman the other day who lost 5 liters of blood in her birth. Now, there's not that much more in the body, right? So she's going to have a longer period of time of recovery. So we want to understand these things and how that's going to impact their training and how quickly we can progress their training. And then you've got the C-section side of things, which if it's an elective C-section, some of those ladies actually recover relatively quickly. You know, by sort of 3 to 4 months, they feel pretty strong and they're getting back to a lot of their exercise. But at the 6 week mark, which is when a lot of women are told, hey, you're 6 weeks, let's have a quick check. Off you go, you're fine. The actual scar tissue is at about 57% of its, strength at that point in time. So I certainly have seen women who 6 weeks after C-section have gone to a postnatal exercise class and they're doing burpees and hill sprints, and that's like day one. And I think what we're trying to do at Girls Gone Strong is actually think, hey, is there maybe a better way of doing this? Can we be a little bit more sensible about how we take women through the postnatal recovery period based on what they were like before they were pregnant, what they were like through their pregnancy, what happened during their birth, and what has their postnatal recovery been like? So it's a little bit more nuanced than saying, you're 6 weeks postnatal, off you go.
Yes, and that's actually, so they're the two biggest myths of postpartum recovery. So we talked about the two big myths of exercise during pregnancy. The two biggest myths of postpartum exercise are you can't do anything for the first 6 weeks, and that at 6 weeks you're good to go to do whatever you want. So I know this is going to be surprising, but believe it or not, there are no magical properties of walking into your doctor's office at week 6 that all of a sudden your body's healed and prepared to get back to whatever exercise you were interested in doing. And so the tricky thing about postpartum return to exercise guidelines is that they're going to be different for everyone. And so a lot of people say like, oh, well, giving these kind of guidelines isn't useful, but also not giving anyone any guidelines isn't useful either. So we use a 3-phase postpartum return to exercise kind of template, right? And this is kind of like standard, didn't have a complicated birth, vaginal delivery, was active prior to pregnancy, healing pretty well. And as you can imagine, as you tick the different boxes, right, it's going to push that timeline out a little bit more. So, okay, more complicated vaginal delivery. Okay, maybe wasn't as active during pregnancy. Okay, ended up having a C-section, right? Each one of those kind of boxes that you tick, struggling with postpartum depression or postpartum PTSD, like all of that's going to kind of push the timeline out. But healthy, uncomplicated, relatively simple vaginal delivery. So the first 6 weeks, when doctors say, or, kind of the standard advice is you can't do anything, that doesn't really make sense because women are having to do things anyway at their house, right? They're having to squat up and down off the toilet. If they have another child, they might be bending over and picking and carrying their 30 or 40 pound child, right? Picking up baskets of laundry, reaching up high, into a shelf. I mean, they're moving their bodies in ways that it would be useful if they could slowly start to integrate some movement and just very gentle strength training back into their program. So for the first 6 weeks, we recommend that women do, if they're feeling up to it, some gentle body weight stuff that's no more strenuous than the activities of daily living. So things like body weight squats, glute bridges, half kneeling hip flexor stretches, band rows, things like that, where they're really just kind of getting their body moving a little bit, bird dogs, cat cow, all that kind of stuff. But they're getting their body moving in a controlled environment. So the idea that a woman shouldn't do anything in the first 6 weeks of pregnancy kind of reminds me of the idea that it's dangerous for kids to strength train, but yet we throw them into like athletic competition in a completely uncontrolled environment, totally ill prepared, right? It's like it doesn't make logical sense. The same thing for women who are recovering from pregnancy, right? Moving their body and getting them to slowly kind of progressively return back to strength training and activity is going to be really useful in not only helping their recovery, but then also helping them return back to exercise. So first couple of weeks, we really just recommend short bouts of light walking and some breathing exercises. After the first 2 weeks or so, that's when they can start with the glute bridges, the clamshells, the bird dogs, the body weight squats, things like that. Again, paying attention to how their body's feeling. They can bump up their walking a little bit, maybe 20 minutes, once or twice a day. And then by the 6 week mark, they can be walking in 30 minutes a day, something like that. These are very general guidelines. So that's kind of what we call the rehab and recovery phase, is the first 6 weeks postpartum. After week 6, between weeks like 7 and 18, we call that the return to exercise phase. So that's when a woman is starting to, if again cleared by her doctor, slowly start to return back to maybe more traditional strength training exercises. So maybe goblet squats, step ups, inverted rows, things again a little bit more gentle, but also a little bit more progressive return to exercise. And so we generally do like maybe 2 to 3 sets in the 8 to 10 rep range in the first 7 to 12 weeks, and then 3 to 4 sets in the 10 to 12. Nothing magic about those numbers other than, they can help you get pretty jacked, but other than it's just a slow, progressive return to strength training exercises that will allow a woman to gain strength without overstressing her body. Could you do 6 to 8 reps? Maybe. Could you do 12 to 15? Probably. But those are just kind of some very general guidelines. And then weeks 18 to 42 is what we call Bulletproof Your Body. And so that's a series of kind of 4-week programs that are just progressively helping the woman return back to exercise, starting to incorporate maybe some more barbell movements. But again, you'll be training differently at week 42 than you will at week 18. So general principles of strength and conditioning slowly progress to more complex exercises, higher intensities, higher intensity of effort, higher intensity of load. She can, be lifting a little bit heavier. She can be, lifting under a little bit more fatigue, things like that, while paying attention to any symptoms that she might be experiencing, specifically pelvic floor symptoms. So that's kind of the general kind of template from weeks 0 to 42 that we recommend, while, adjusting as necessary for her individual experience with labor and birth and any complications she might have experienced, and just her overall energy level, whatever other kind of postpartum life experience she's having, whether she has multiple kids to take care of, she's doing it as a single mom, she's having postpartum depression, things like that. All of those can be serious, obviously, barriers to returning to exercise.
It makes a lot of sense. And, Omar, I couldn't help but think how the times we've had some of our injury specialists on, a few roundtables on that, and the discussion around kind of return to play or return to training and graded exposure. Which, when viewed through the performance lens, is progressive overload, and overtraining. Like, you don't want to take on too much that you're not used to, or you're going to get a negative adaptation or potential injury. It makes a lot of sense based on there being different demands that you can place on your body through each one of the trimesters, the needed recovery after birth. You wouldn't just want to jump right back into it. Although I think a lot of athletes who are listening, that may be the emotional drive to do that. I know it would be for me when I came back from hip surgery, or when I came back from lockdown. It's like, oh, now I can make up for all the training I missed. That's a great way to have like a recurring injury, though. From what we know, we have, as we've had our prior guests who I was referring to earlier, like the doctors and physical therapists, real doctors, I mean, like from barbell medicine and whatnot, who have expressed how we don't have a great ability to predict injury, but one of the things we do know can predict injury is poor load management. So meaning you got detrained and maladapted to handling a lot of load, and now you jump right back into it and have a big spike in your chronic to acute workload ratio. That's one of the few things we are relatively confident can lead to an injury. So I don't know about you, Omar, but I feel like there's a lot of parallels here, a lot of the same principles being expressed just through a very, different and specific lens.
No, I think this episode is in perfect alignment with the cult, where it's a deep dive into a topic that is very necessary. And I think from the outset, if you were to ask most quote unquote evidence-based fitness trainers, it's kind of one of those reductionist statements that, we've heard all too often on Iron Culture. We do the deep dive where it's like, just train hard and eat enough if you want to grow. Okay, cool. When it comes to something else, oh, don't worry about it. Like, technique. Yeah, like, sure, it doesn't really matter. Or, oh, you're pregnant? Yeah, you could train through it. And so to have that reductionist mindset challenge, and also to, I think, truly empower a portion of the audience that we've all probably experienced that feeling before, when you first arrive either at the gym or just in general, the feeling of being lost, being uncertain, unsure of yourself, having doubt where doubt, maybe there's fear, and all insecurity too. There's a lot of things happening with the body. We all, I think, even if you're not pregnant, have never been pregnant, even if you're just a guy, listening to this, you could probably relate to some of those feelings. And so to provide a framework for understanding is, to me, kind of one of the definitions of empowerment. So I think even if this isn't relevant to you, it's probably relevant to someone you know. and it unites kind of, Eric, the general thrust, I would say, of Iron Culture, which is uniting all lifters, because we all want people, to lift and actualize themselves however they think that should be. And so hearing all this, I got to be honest, I'm probably going to write a stern letter, Molly, and to Arnold, just because I before this, I was like, okay, like, they wouldn't put out a movie that's not true, and there's just so much that movie gets wrong, to be honest.
Yeah, it's another example of how we were failed by movies in the early 90s and late 80s that we grew up with.
Yes, and I want to rant about one more thing, because I haven't had a chance to rant about this enough yet, that is relevant. I know we don't like to stay relevant on topics and stuff on this podcast, but this is relevant to what we were just talking about, is the lack of information for women about, again, how to return to exercise post-pregnancy, and the lack of kind of, again, planning of what it looks like to return to exercise, and the lack of referral to a pelvic health physical therapist or physiotherapist. So this makes me real mad. When we were working on our pre and postnatal coaching certification, my partner Casey ruptured his patella tendon, full rupture, had to have surgery, and he had this like incredibly precise, slow, like return to like physical therapy and exercise, right? So he had the surgery, and it was like, okay, at this many days, this is what's going to happen. And this many weeks, you're going to see this physical therapist, and you're going to have this many visits per week, right? And then I'm learning more about women having C-sections and literally, being sliced open and have their babies pulled out of their body. Their doctor's like, oh yeah, just like the scar, when it heals, like you're totally fine to return to exercise. And it literally makes no sense, right? That women, so many women, especially in the US, I know we're all based in different countries. So Marika's in Perth, you're Erica in New Zealand, Omar, you're in Toronto. But in the US, women often get like 2, maybe 3-day hospital stay after they have a C-section. They often have to fight with their doctor for a referral to a pelvic health physical therapist. So many people don't even know pelvic health physical therapy is actually a thing. So, there are plenty of physical therapists who don't know that pelvic health is a specialty, or they kind of snicker at it a little bit, right? Because it's like they don't fully understand it or don't really know what they do. Or they think that the OBGYN or the doctor who does the checkup with the woman at 6 weeks is doing what a pelvic health physical therapist does, which I'll let Marika rant on that in just a moment. But yes, these women are literally having major surgery or significant stress or trauma to their pelvic floor, and they're not being referred to a pelvic health physiotherapist post-pregnancy and post-birth the way that someone who has been through an injury is. So that's something that we're really trying to raise awareness about and change at Girls Gone Strong, because it's a lot more common in other countries. Like women get like an automatic referral to a pelvic health physio, even if they didn't have a C-section. So that's something that we're trying to change here in the US. But yeah, Marika, you might want to talk a little bit about the OBGYN and the checkup that they do at 6 weeks versus what the pelvic health physio does.
Yeah, it's pretty different. So in Australia, when women go for their postnatal 6-week check, it's often with their GP, their general practitioner. It involves, hey, how are you doing? Great. How's the baby? Awesome. Here's some birth control. Maybe a pap smear, and then that's it. Even the women who have a pap smear, they don't have a pelvic floor check. So some women come in and they say, oh, yeah, my doctor did that. And so I'll ask a whole series of questions. Oh, no, didn't do any of that. So I think sometimes there's this idea that they're having a pelvic floor check, but really they're often checking if a woman's had a tear, if the stitches have healed, and they've maybe had a pap smear, but they won't actually check the pelvic floor muscle function, and they won't check for prolapse. And prolapse is something we kind of haven't really talked about, and I might just describe what that is, because a lot of people have never heard of the term. But basically what we're talking about is, so within the pelvis, you've got the bladder, the uterus, and the rectum sitting in there, and they're held up by connective tissue, ligaments and fascia from above and from the sides, and then underneath we've got the pelvic floor muscles which support them. So through pregnancy and childbirth, we obviously get some stretching of the pelvic floor, which I think is about 3.5 times its length it's stretched. Not many muscles can do that. And then if you're having that bearing down through pregnancy, you can also get stretching of the connective tissues and ligaments from above as well. If you add constipation during pregnancy, if you add lots of really heavy lifting, maybe. and putting on lots and lots of weight. These things might increase your risk of prolapse, where basically you get that stretching and the organs can drift down towards the entrance of the vagina. So one of the key things that's really important for coaches and trainers and the general public to understand is that if there's a feeling underneath, like there's a lump or a bulge in the vagina, or if it feels like there's a heaviness or a dragging sensation, there is probably pelvic organ prolapse there, okay? Now this is where it becomes challenging working with heavy lifters. And if I can just take a little step back, we've talked about how much the pelvic floor stretches, and we're wanting that to obviously have a period of time of recovery. I'm going to make a V shape with my fingers while I'm talking to you, but your your vagina and your urethra, actually, there's like a gap in the pelvic floor between the two sides of the deeper layer of the pelvic floor where those two tubes kind of go in between. Now, during childbirth, those two muscles kind of get separated, what we call the levator hiatus. You have a bigger gap between the two sides of your pelvic floor, which allows things to basically drop down in between. There is a natural recovery postnatally over months where those two muscles, as they get stronger and as things recover, they come closer and closer towards each other, and you've got more support for your organs. So if somebody had, I'm just thinking again from a lifting perspective, if someone had a traumatic birth with forceps, with some muscle damage, she's got probably a wider gap between the two sides of her pelvic floor. She's kind of a sitting duck in a way for a prolapse. Is that someone that I would want to do heavy lifting at 8 to 12 weeks? Hell no. How do you know that? Now, as a pelvic floor physio, I would spend an hour with a postnatal lady and obviously go through a whole history, but then I go and have a look, and there are some measures that we do. We look at the muscles, we look at whether or not there's already prolapse, and there's some measures that we take which give us an idea of whether she is at a big risk of prolapse. So if I see someone who has already some prolapse sitting there that she's not aware of, it's not symptomatic, but she has some measures that are really big which show that the gap is quite wide, she's someone that I'm going to be a lot more conservative with in terms of the recovery, because I don't want her to have a massive prolapse. Molly and I have talked about this. Mild prolapses do really well with physiotherapy. So we manage them conservatively through muscle training, changing lifestyle habits, sorting out their bladder and bowel. Sometimes we give them what's called a pessary, which is something you actually insert into the vagina, which holds things in place. But there are some women that have to go on to have surgery. The failure rate of surgery is really high. It's around 30.
I'm like, let me drop these numbers. Up to 19% of women in the U.S. will have surgery for pelvic organ prolapse or incontinence by the time they're 85, and 30% of them will have multiple surgeries. Oh, shit. One in five women that will have surgery for incontinence or pelvic organ prolapse, which Marika said is the descent toward the exit of the vagina of one or more of the pelvic organs. So literally 1 in 5, and no one's talking about it. And trainers have no idea how to help people, and women have no idea. With incontinence, there's a lot of thinking that it's normal, thinking that it's something they have to live with. With pelvic organ prolapse, especially if one of the organs is beginning to descend out of the vagina, there's a lot of shame associated with it. And certainly they think that nothing can be done about it, right? And so anyway, just that number, I always like to rant about that stat because that one's absolutely ridiculous. But yeah, the failure rates, or the recurrent having to do a second surgery is 30%. Okay, Marika, back to you.
Oh, no, I was going to say, yeah, go ahead and rant, because women will say to us, like, why didn't anyone tell me this? And we work with a lot of personal trainers who never heard of prolapse until they develop prolapse after their babies. And they're like, why the hell have I never heard of this? I would have done things probably differently. Whether or not that would have made a difference, that's always a hard thing to answer. But I think, we just want to get the word out there that it exists, and that there are some risk factors that we want to watch out for, and that there are some people who we will have to put the reins on. And, we are so big on supporting women to get back to doing everything they want to do, but we want to make them aware of the risks of some types of exercises in some situations, so that they have the autonomy to say, well, look, I'm okay to push through, or actually maybe I want to do something about that now and take a little step back, give myself a bit more time to recover, so that I'm looking after my long-term health. Because, I did a survey I got about 110 women with prolapse. This is a few years ago now. I can tell you, I cried. I bawled my eyes out reading these comments, because some of the women were suicidal. They had no idea this was going to happen. Their doctors told them, oh, well, it's just normal, or said, well, you did this wrong, or you did that, or you shouldn't have done exercise in pregnancy. There was a lot of blame. There was a lot of guilt. And honestly, the number of women who just said their lives were over, they couldn't see a way out, there's no light at the end of the tunnel, it had me in absolute tears. And, what we do as pelvic health physios is, try and minimise the risks wherever we can, and then help women, support them, get them back to doing the things that they can. And, Molly was talking a lot about in pregnancy, what are the things you can do? Because we are always about don't do this, don't do that, don't do that. We actually should say, here are all the things you can do. Because from a mindset perspective, giving a menu of here are all the things you can do right now is so much better than here's a list of things that you can't do. And I think that's important, really important with prolapse is we want to get women moving, absolutely. And if they have to take a bit of a step back, but we've got to get them in the gym. Like we've got to get them back in those environments where they're surrounded by the people that they love to have fun with. I get the feeling you guys have a bit of a laugh when you work out, maybe.
Oh no, it's serious game time. There's no laughter allowed at all. No, but absolutely. I think this is probably true of many of our listeners, and I think it's a huge part of adherence and sticking with it. And the reason why, if anything, a lot of our women listeners who might go through pregnancy might err on the side of doing too much is their favorite part of the day is training. So I think this is all really, really helpful information. And I could see absolutely if someone was to experience, prolapse and have a significant impact on the thing they love, that would only compound that, having your ability to have your physical expression of self be limited or hampered or have to change significantly in a relatively short time period, and not to have any idea that it could have happened or know what to do when it happens. I 100%.
Yeah. And I mean, it's not just the lifting, right? It impacts their perception of their body. It impacts their body image. It can impact their sex life and their intimacy with their partner. I mean, 30% of women are still having painful sex at a year postpartum. So, I mean, there's just so many things going on. So again, if she's got postpartum depression, some type of PTSD, she's possibly experiencing some sort of prolapse. Maybe she has a colicky baby who's crying all the time. She's having pain, when she tries to have, sex with her partner, she's having painful sex. Like there's just so many things, and then she can't do the one outlet, the thing that she loves every day, or she feels like she can't do that thing. It can be really, really, really kind of powerful and detrimental to her overall well-being. Marika, I would love for you to drop some numbers on prolapse, incontinence, pelvic floor dysfunction, things like that on this podcast, because I think it's easy to think like, oh yeah, okay, so 1 in 5, like that's still not that many, right? But 48 to 67% of women are leaking urine by week 30 of pregnancy. So 48% of women who it's their first time being pregnant, and around 67% of women who've been pregnant multiple times are leaking urine by week 30 of pregnancy. And then Marika has some, so it happens a lot in pregnancy, but also post-pregnancy. And there's a lot that can be done conservatively in pelvic health physical therapy to help women who are having those symptoms. So Marika, I'd love for you to just some of the numbers.
We could play the game that we played with your fellow.
I don't know if it's a friend. I think
your fellow podcasting rival,
acquaintance, a distant acquaintance.
It's difficult to call them a rival when they don't even begin to approach your level of success. But for their benefit, we'll use that word. Sure.
Sure, that'll make them feel good.
Yeah.
Well, Greg can't feel, so.
Oh.
Greg, as a computer program, he can imitate what it looks like for humans to feel, and we want him to be able to have that experience.
Yeah, he can learn the facial expressions. So we actually talked a lot about general population, not even women who have just had a baby, because, the stats can be really high in that postnatal period. But I think what you might find surprising is just the general population where women are exercising in a gym. So they did a study here in Perth a few years back where they just stood outside a gym. Actually about 5 different gyms, and women came out and they said, do you have any of the symptoms of pelvic floor dysfunction? 49% of women had stress urinary incontinence. Now, some of these women had never had a baby, some were young, some were old, but just in the general female population, almost 50% of women had some symptoms of stress urinary incontinence. And then when we look across the board at different sports, cross-country running, about 50%. Netball is, you probably don't even know what that is. It's a bit like basketball. It's like 1 in.
But no backboard. You can't dribble and run. You have to like jump, catch the ball, and then have really bad Q angles. It's basically an ACL nightmare. But go ahead, yeah.
Almost as much as the AFL at the moment, which is about now. Yeah, we won't even go into that. But you live in New Zealand, so you should know netball really well now.
I do.
Hopefully supporting your local team. Netball's about 1 in 3. Want to have a guess for gymnastics?
Go, Eric.
Oh man, I would think it would be pretty high. I'll say 40%.
Omar, any ideas?
Yeah, I'm going 60.
70 is 70%.
Wow.
And trampolining.
100%. No one makes it out alive.
Pretty close. 90%.
Damn.
Wow.
Yeah, so there's been studies, and actually in powerlifters, there was a study in Australia, I think it was a couple of years ago, that was 42% of the women that they studied. It wasn't a massive study, I think it was like 100 odd people, but, statistically, you got to be thinking then that there's probably women that are in your gym that are having issues of leaking. And prolapse, again, a lot of the stats sit around 1 in 3 at some point in the life will have symptomatic prolapse. In the postnatal population, if I went around and took every woman who's had a vaginal birth and checked for prolapse, most of them will have some degree of mild prolapse in there. Whether or not that's symptomatic is another story. So I think, statistically, we've got to understand that a lot of women having these symptoms, they're often not talking about it. Sometimes they will reach out for help. Sometimes they have no idea that exists. And I think we want this conversation to be happening. We want people not to feel embarrassed by it. I would love it if a woman could have that comfortable conversation with their trainer and say, hey, when we did those box jumps the other day, because box jumps and double unders are killers in terms of pelvic floor. No, not killers, sorry, that's the wrong term. But in terms of leaking, they're two of the biggest things that we'll see, like in CrossFit and things like that. But I want women to actually say to their coach, actually, I leak when I do that exercise. And then the coach can start to think, well, is there something about that exercise that I can change? Is there something about the way they're doing that exercise that is actually making them leak? So with double unders, is it their landing strategy? Is it their breathing strategy? Are they locking down from up here and using, creating a truckload of intra-abdominal pressure? Is there something about that exercise that we can change that can actually reduce her risk of leaking? And so we'd love coaches to start to explore that kind of stuff, but absolutely work with a pelvic health physio so they can have a better understanding of what is happening and internally that you can't see from the outside.
Marika, I'm glad we went here because I knew it could have been seen as a bit of a tangent because it, like you said, it doesn't happen just in women who have given birth. But I tell you what, anyone who's been to a large powerlifting meet or a large Olympic weightlifting meet, bottom of a heavy clean or third attempts on deadlifts and squats, I have seen meets where I would say it is the majority of women who are visibly leaking. And I would say that because it is so common, the general attitude is it's going to happen. Doesn't mean anything. Don't worry about it. Carry on. Like, it's just the reality. If you want to pull, a sumo deadlift 3 times body weight, like if you watch, primetime USAPL nationals, some of the strongest women in the US, I would say maybe half, if not more, like just from what I've seen, are experiencing that. Is that a problem? When is it a problem? The general attitude, like I said, I have never experienced it personally, but from the outside in, it's like, it's whatever. It's when I deadlift. Is it an annoyance that you just deal with and make sure you can clean the platform between attempts, or is it something that really people should be taking a little more seriously?
Really good question, and because we don't know the long-term consequences of that. And, in that powerlifting study, and I think, I said there was 40% of women leaked, but a lot of the times when they did leak, it was in competition. And again, that's probably, you're going to hit your bigger load then, right?
Yep. Is
it a tissue threshold problem? Like, is it always going to be that? Like, I had a woman a little while back, and she sumo deadlifts. Every time she gets 170 kilos, I don't know what that is in pounds, like 380 or something.
374.
Jesus.
I think.
So is your math's really good, or just pull that? Wow.
I'm an American
who
lives in New Zealand. It's just because I have to convert all the time. Head
instantaneously.
Yeah. 2.2. Well done. So she would lift 170 kilos fine, but every time she hit 180, she would leak. So then we look at the strategy. I did a pelvic floor examination for this particular woman and looked at her muscle function and some of the weakness that was there because she was a postnatal lady in particular. Now, what can we do about that? So we can look at strengthening. Like we can look at getting a freaking strong pelvic floor. And I do think if you're going to pull 200 kilos off the floor, you want to have a really good pelvic floor because that's a lot of pressure. And we've talked about Valsalva. We've talked, you need that brace. We want lots of pressure. So we want to have a really good pelvic floor. What is the strategy that she's like lifting with? Is there anything that we can change there? Like, is she using a belt and really trying to bulge out through the belt? Is she taking a massive breath? If she breathes out a little bit and then braces, does that change her leaking pattern? Do all that kind of stuff. See if we can reduce the symptoms. Ultimately, if she keeps doing it, will she have a problem later? She may do. We don't know. She may not. Some women actually in the powerlifting study found that actually when they started lifting more, as they got stronger, their leaking actually improved.
Okay.
So for some women,
that's a good
there's
sign.
that. Yeah, maybe.
The answer's always just get stronger. So I love it.
So we don't know. And also, like, I think realistically, there just might be a point in which our tissue tolerance just can't deal with that kind of load. And I think there will be some women who, no matter what you do, and you might put a pessary in to help like lock off the urethra, like give them like a backstop. We might strengthen the hell out of it, we might change their technique, we might do everything we can, and she still might kind of be here. And then when she just goes that little bit more, the tissue tolerance just can't cope with that. And so I don't know the answer to that. I think, yeah. Sorry, Molly, I know you were going to say.
I was just going to say, and Marika, you can probably speak to this a little bit better, but like when you kind of look at the pelvic floor, like you build a lot of functional reserve in your pelvic floor when you're younger, and that their genetics has to do with that, activity levels can affect that, nutrition can affect that, and then there are different things that can kind of, again, it's like, what's the straw that's going to break the camel's back, right? So like a woman might not have any symptoms during pregnancy. She might not have any symptoms after pregnancy. She might lift for a long time and not have any symptoms, and then menopause hits, right? And there's like changes in hormone levels. There's maybe some like atrophy going on, or maybe she reduces her activity level for some other reason. But like there are, it's like it's hard to know exactly. Like Marika said, is it a just absolute tissue threshold? Is there going to be an inciting factor at some point in her life that's going to be the thing that makes her all of a sudden have symptoms? Is it like at 400 pounds it always happens, or is it always at 90%? But that 90% shifts as she gets stronger, right? It's kind of hard to know, which is why, again, but for a lot of women, they're willing to take those risks, right? People who compete at a high level in different sports accept the potential, risks and downsides to, that come along with the thing that they want to do, right? No matter what that sport is. So I think education is the most important thing. And so that you don't have women saying, I had no idea, no one told me, I never knew this might be a problem. Sharing this information with them, bringing awareness to it, connecting them with a pelvic health physical therapist who can actually do, an internal examination and say, this is what's going on. And then allowing her to kind of make that decision for herself and say, hey, I really want to, compete for this spot in this particular federation in this weight class. And like, if I pee, I pee, so what? Or, I'm going to lift until I get to this age and then I'm going to stop, or whatever. So I think the education piece is key. And like Marika said, there's just so many unknowns because there are ethical implications to doing the research. But yeah, it's just kind of raising awareness and educating them and giving them the opportunity to make the informed decisions that they want for themselves.
Awesome. I think that's I'm really appreciative. I really appreciate that. I'm glad we touched on this subject. If it's cool, I want to add just a few anecdotal things just from trial and error as a coach that I've had working with some female lifters. I found, and from talking to other female lifters who've worked around this themselves, periodizing in periods of doing beltless training. Obviously, using a belt is a skill in and of itself. So it doesn't mean that you train this way all the time, but it definitely, if it's something that's annoying, distracting, and not something you want to experience every time you deadlift or squat, I don't think there's anything wrong with going through a phase of training when you're a little further from competition, not wearing a belt, a little less intra-abdominal pressure. I've seen in general that tends to reduce the frequency. Also on deadlifts specifically, instead of doing like high rep sets or even moderate rep sets, breaking that up. So instead of say doing 3x5, doing 5x3 at the same load and just letting that RPE be a little lower. Again, obviously, as you get closer to competition, if you want to put up a 1RM, you're probably going to need to be training singles at a relatively high RPE, or stimulating a little more stress from doing higher RPE sets. But certainly you can limit your exposure, and those are two things: breaking up kind of longer rep sets into more number of sets with lower reps with a lower RPE, and then phasing in and out of belted training. That's been some of the things that anecdotally I've seen has been successful when we've tried that, and when I've talked to lifters who are struggling with that. Anything else that you guys have noticed just in practice that's worked well to add to that, or anything else?
There will be some women who really struggle with sumo just because the wider stance puts the pelvic floor on more of a stretch. And so there may just be some women who just really struggle with that particular stance, whereas in other positions they're fine. So I just would probably chuck that in. Molly mentioned sort of building pelvic floor capacity during the sort of formative years and something like that. And I just wanted to throw in that the eating disorders can be a big problem, especially in the sports where obviously aesthetics are really important, or if there's particular weight categories and people trying to cut, because for what, if someone has bulimia, obviously that's an issue because that intra-abdominal prep, like vomiting, those women they'll tend to have a lot of pelvic floor issues. We do see a lot of women, with the gymnastics, I mentioned the statistics are so high. And part of it is we don't know whether it's just that bounding, landing kind of thing, but also the tissue quality in their pelvic floor from malnourishment. We see lots of stress fractures and things too, but I kind of just want that to be a little bit of a warning bell, because I think, within the athletic population, it's like 20% of athletes or something like that have eating disorders. So if you're working with high-level athletes, what's going on with their nutrition too? Because that can affect their pelvic floor function.
Excellent. Actually, that's a perfect segue, because we've talked a lot about training, and one sport that I'm a proud member of, where we absolutely blow away that average value of number of eating disorders of 20%, and we defeat that number handily, is physique sport. I personally have been a big time proponent of physique sport for a long time, but most importantly, from a perspective of giving people informed consent. So I think, much like you guys discussed how people aren't even aware that prolapse is a thing, or all of the potential things that someone needs to be aware of, they're going into training while pregnant and coming out of it and having a healthy birth and healthy recovery, and then getting back to being an athlete. Physique sport is the same way. People have a lot of misconceptions about it, and it is absolutely something that, if you go into with those misconceptions, can really cause some mental and physical detriments. So I'm always a huge proponent of making sure everyone fully understands what they're getting into, and make sure it is still for them. And if they want to be one of my iron sisters in psychosis and get on the stage, more power to you. I just want to make sure you know what's going on with it. So let's talk about physique competitors who go through pregnancy, and maybe they come back to wanting to compete. What do they need to be? I think a lot of physique competitors I've talked to, one of the bigger struggles they have is wanting to be on a diet, wanting to reduce their body fat levels, getting to a place maybe even beyond what they normally are comfortable with in the off season when they're in a muscle gaining phase, and needing to learn to be comfortable with what is actually healthy for this phase of their life and pregnancy. And then that's being a challenge. Is there a lag time before they should be not dieting? Is there a lag time before they should consider competing again? Is that, related to when they're breastfeeding or not? I've basically big open, can of worms here. But if someone is a physique competitor or very interested in aesthetics and modifying their body composition, what does the time course of that look like, and what should they be aware of and consider?
Yeah, so that is a fantastic question. So if we start with pregnancy, right, the average kind of recommended weight gain for a normal kind of woman carrying a normal amount of body fat is around 25 to 30 pounds. If a woman falls into the category of overweight or obese on the BMI scale, which obviously we know is not always the best measure, but that's what we have data on. So if they fall in that kind of range, gaining around 15 pounds during pregnancy is considered healthy. And then, but if a woman comes into pregnancy quite lean, that's kind of where it's tricky for a lot of competitors who maybe typically walk around a little bit leaner. A healthy weight gain for them is going to even be more than 25 to 30 pounds. So it could be in the, 35 to 40 pound range, which can be kind of, difficult for them mentally and emotionally to see their body change.
I know I'm interrupting and I apologize, but I think this is just a really important point because a lot of female physique competitors, they're lean, yet their BMI would put them in that category. And that concerns me because they may be getting told something that is the exact opposite of what they should be doing from a GP. Like, hey, we don't want you to put on too much, but my body fat levels are like 18% or something like that, So they would actually, just so they understand, and it's not absolutely what they probably want to hear, they would need to gain weight as though they were someone who is lean, not just based on what their BMI was. So I wanted to interject that. But
no, I appreciate that. I think that's a super useful thing, especially because again, we're talking about like data in populations of people, right? Not necessarily how it applies to the individual. So I think that is really important. So in terms of weight gain during pregnancy, if someone comes in normal at a quote unquote normal weight, they're going to be around 25 to 30 pounds is considered healthy. If they are someone coming in quite lean, then somewhere in like the 35-ish range might be considered healthier. So then if a woman chooses to breastfeed post-pregnancy, here's the interesting thing about breastfeeding is that a lot of people think that if you undereat, and well, it is possible if you undereat, you don't stay hydrated, you're not taking in enough energy, enough calories, you won't produce as much breast milk. But the interesting thing is, if your diet, if you're not consuming enough nutrients and you are still breastfeeding, your body will take everything from your own body's reserves and stores and put it into your breast milk for your baby. So again, evolutionarily, your body's like, okay, you're not getting enough calcium in your diet. We're just going to take it from your bones basically and give it to your baby, right? So if you are not eating enough, your baby, again, if you're producing breast milk, your baby will probably be okay nutrient-wise, but you might be struggling. You might be the one suffering because the baby's going to get the nutrients and you aren't. So the World Health Organization says if women choose to breastfeed, that they recommend breastfeeding until about 2 years. The baby's about 2 years old. In the U.S., it's a lot more common for women to start breastfeeding between 6 and 12 months. There are a lot of reasons why that happens, everything from, logistical to socioeconomic. If she has to go back to work, to it can be really difficult to be pregnant for 42 weeks and then have another being attached to you for the next 2 years and be reliant on you. Marika's nodding her head. So, at GGS, we're always like a fed baby, like fed is best, right? People like to say breast is best, whatever, fed is best. So the best thing that you can do is feed your baby on a regular basis. Obviously, there are huge benefits to breastfeeding, but certainly there are plenty of women for whom that's a really difficult thing, or it's not something they can continue for a long period of time. I would not recommend being in a large calorie deficit or a large energy deficit while you're breastfeeding. Again, it can be harder to produce milk, which can be really frustrating for you and for your baby, especially if you're trying to exclusively breastfeed. And then if you are undernourished, then your body's going to just pull from your own nutrient reserves to bring that into your breast milk to give to your baby. So I would not recommend being in an energy deficit if you were trying to breastfeed. For some women, they find being maybe like 3 to 6 months postpartum, being in a really small energy deficit of maybe like 100 to 300 calories per day, they're still able to produce adequate milk supply for their baby and also see some body fat loss. We definitely don't recommend trying to lose body fat, at least somewhat. It will happen naturally for some women. We don't recommend like a hardcore regimented fat loss program like earlier than 3 months postpartum, right? It's too much stress. Like your body needs the nutrition and the energy to help repair from, and recover from pregnancy and the birth process. I always almost say delivery. And then I remember the midwives say pizzas are delivered, babies are birthed. Your body has to recover from childbirth. So I think 3 months would be really early. 6 months would still even feel a little bit early to me. But for women who are very intent on getting back to it, I would say that 6 month mark would probably be appropriate for most women who were interested in trying to start kind of slowly but surely losing body fat. If they're not breastfeeding, there's going to be less to consider because they're not having to think about their milk production. But still, I think that 6 month mark probably physically and mentally and emotionally would be a spot that, I wouldn't want to go too much sooner than that. So 3 months would be pretty extreme. 6 months, I think, would be better for most women. But that's just general. I mean,
Absolutely.
everybody's going to be different.
I like what you said there about, I think we've talked about this a number of times on Iron Culture about how, especially in the bodybuilding community, there's always this idea that everything needs to be manipulated with nutrition. Like I have to be actively doing something. And the natural time course, in general, of course, like you said, individual differences are going to occur in individual differences environment. There should be weight gain that happens without needing to institute a calorie surplus, and there very likely will then be weight loss without needing to institute a calorie deficit. And I think this might be a great opportunity if someone is considering having a child and they have previously been very regimented with their nutrition as another way to look at nutrition. This is not only for my own health and my life, but also for that of my forthcoming child. And this is one of those times, and we said it's very common among women where it is important to try to get that body awareness and to have some of those elements of intuitive eating that we talked about. We've talked about with Gabby Fondaro. We've talked about with Jake Lenardin. We've talked about with Corey Probst and a number of other people about how easy it is when you are intent on physique sport to let nutrition become this thing that is almost separate from you, that you manipulate. Often at the cost of your mental health, and how important it is for physique competitors to be able to come back to a more intuitive, healthy, if you will, natural, quote unquote, as much as it can be in the modern world, eating lifestyle. And this is a really good example where that's critically important, and where the demands that have been on the human species since its inception align again with that message. So anyway, I just appreciate that. Is there anything else that you guys want to talk about in the realm of nutrition, especially for athletes? Are there things that they need to change that they might do habitually, like if they're used to eating a high protein diet or taking supplements? Are there certain that become inappropriate if when or after they're pregnant?
Can I just add one thing? I'm not going to talk a lot about nutrition because as a physio, I just handball all of that to my dietitian next door. But what I will say is there does seem to be a lot of, well, there's not a lot of research yet, but I think there's this thought process happening now about something called postnatal depletion, and you may have heard the term or not. And we will sometimes see women 1 or 2 years down the track, maybe even more, who are developing chronic health conditions and sometimes sort of autoimmune conditions that crop up further down the track. And there is this thought that, especially with women who have pregnancies back to back, and I'm just thinking now with your competitive athletes as well, who are maybe putting their bodies under more stress early, because, you've got to remember again what Molly was saying about your baby. Honestly, like I've had patients who have been so sick through their pregnancy, they've literally barely been able to eat, and they've produced a baby that is, freaking 8-9 pound. The baby will take everything out of you. It'll take it out of your bones. It'll take it out of all your storage supplies. It'll leave you with nothing.
Don't lose. Don't you let that baby beat you.
So there are some things to consider nutritionally during pregnancy where possible to really keep your stores up. But postnatally too, you're going to need to rebuild those stores. And again, this is just not my area of expertise, but it's just something that we see is that women who have really not had good pregnancies, whether they've had hyperemesis, where they've just been vomiting all the time, or there's been other stresses in their life, or they've had a traumatic birth. And then I can just sort of imagine then going into calorie deficits too early. These are the women that I can imagine 1 or 2 years down the track having thyroid issues, having chronic joint aches and pains, who are coming in through our doors, and they've just got a list of health conditions now. And so I don't know, that's just, as a health professional, I just kind of want women to just take a little bit of time to really build themselves back up, get the rest and recovery, get the sleep, sort out the mental health side of things, definitely get moving, eat really well, get that wide range of, vegetables and protein. And I don't go too much into that side of things, but I just think build up your stores again, and where possible, see if you can have a 2-year gap between births. Don't have babies back to back too quickly, because you go from pregnant, breastfeeding. These women I see 4 years down the track, they're just smashed, honestly. not based on science, just anecdotal.
Yeah, and then they feel like they have to quote unquote get their body back, and that they're supposed to go back to work, and they're supposed to work like they don't have kids and parent like they don't work, and all. I mean, it's just so many changes going on in their lives, so much stress that is not even necessarily from nutrition or exercise, that I think just contributes to the overall stress load on them that just can make things a lot more challenging.
Fantastic. No, I think those are some excellent comments. Really good perspective, very practical for the athletes who are listening, who are maybe at that point in their lives where they are considering this is something in the near or even far future. Omar, I wanna check in with you, my friend. Is there anything that I haven't asked that you have thought might be relevant to the cult or our listeners that might be good while we have these two amazing experts on?
You know what? I'm going to pass the baton, and I'm going to open the floor back again to Molly and Marika, just to cover anything that you feel would be pertinent, relevant to any of the audience or their significant others, so that they might know and they too can lift and win that battle against their yet to be born child, because it's a battle.
Molly, I cut off that answer to that question about fat and protein and carbs. Did you want to hit the macros?
I mean, again, that's kind of something that I rely on other team members of ours for, the registered dietitians and the folks with PhDs in nutrition, to get really specific. Like you were saying, Eric, we do make a lot of intuitive eating recommendations, and, try to keep things as simple as possible in terms of getting them to eat when they're hungry, stop when they're satisfied, make sure they're getting a portion of protein and fruits or veggies and a serving of fat at least every meal, maybe adding in some other more kind of starchy carb sources if they feel like it, not stress out too terribly much if they're experiencing a lot of, morning sickness or nausea. Like Marika said, even if they're not able to get enough energy intake in, their body will figure it out. There's an interesting thought that women need an extra 300 calories per day in pregnancy. That's not technically true. It makes sense, right? You're not going to need the same amount of energy to grow a little tiny bean as you would to grow, to feed or nourish like a 7 or 8 pound baby. So it's actually, there are no extra calories or energy intake required in the first trimester. And then in the second trimester, I think it's around 300. And then as you get to the third trimester, it gets up to about 450 or 500. But again, we don't generally recommend women count calories during pregnancy. We recommend that they listen to their hunger and fullness cues. In the first trimester, they might be a little bit nauseous. Some women find liquid nutrition is a little bit better for them. Soups, protein shakes, things like that. There are food aversions. Meat is often a food that women feel really averse to during pregnancy. So during that time, things like, cottage cheese and Greek yogurt and protein shakes and things, and other plant-based protein sources can be more helpful for them if they're feeling really averse to meat, to make sure they're getting enough protein. In the third trimester, as the belly grows, they can actually feel like their stomach is kind of getting, shoved up a little bit. So it can be hard to eat a lot in one sitting. So a lot of women find that grazing throughout the day is a little bit easier for them. But yeah, I mean, again, we kind of rely on the, eat a well-balanced meal, some type of protein source, some type of fruit or veggie, some type of fat source, some type of carb, sweet potato, rice, bread, things like that. Kind of tune into your body, make sure you're drinking enough water. Supplements are really tricky. We get, again, into those ethical implications of testing supplements on pregnant women. Most supplements will say, do not take when you're pregnant, but, plenty of pregnant women I know, you didn't hear this from me, take protein powder and EAAs and, occasionally creatine. I think there's actually evidence to suggest that creatine can have positive neurological effects on babies. I can't remember off the top of my head, but I think that is true.
It wouldn't surprise me. I wouldn't be surprised if it wouldn't have a positive effect on neural tube development and stuff like that, based on what we know it does.
Yeah.
Yep. Choline is really important, which is found in eggs. Choline is incredibly important. Omega-3s are important. Taking a fish oil or something during pregnancy is also important. Choline, omega-3s, protein powder, creatine, EAAs. I think that pretty much.
A lot of women end up in iron supplements because iron drops low in pregnancy, and I would just encourage women to make sure let's just go talk to the pharmacist or whatever, get a good quality bioavailable source of iron, because so many women get directed by their doctor just to go get we use Ferrograd here, which is really not great, and most women end up really constipated, and then that's a pelvic floor concern as well. They get really backed up. So if you're on iron, get a good quality one.
There's also folate or folic acid, and I can't remember. I think folate. Is works well for almost everyone. There's like an MTFHR like gene mutation or something that means some women need folate versus folic acid. I can't remember off the top of my head. I've remembered a lot of stuff on this podcast today, you all. That one I can't remember in particular. But yeah, folate I believe is. I know it's really important for pregnant women, but I think folate is the thing that you want over folic acid, particularly if you have that gene mutation.
Well, listen, you've both been giving us a master class on the topic, and I really do hope and I recommend that no one is looking for all of the answers for what to do for the pregnancy in just this one podcast. This should be your gateway drug towards hopefully finding more resources from a nutrition and training perspective and mental health perspective to make sure that you are growing the next generation of soldiers in the Iron Cult, and also making sure that you do have that baby start with a chip on their shoulder. Understand that you're the dominant, because I think babies are pack animals. This is much like wolves, that's what they came from. Can you keep a straight face for that one? Make sure you beat your baby in that hypertrophy war. Mm-hmm. And please follow up with all these wonderful resources. So with that, Molly, Marika, where can the listeners, like Omar said, whether they are considering pregnancy on their own, they're the partner of someone who might, where can they find more about this topic so they go in armed to win that war against their child?
Yes, absolutely. So if you're a health and fitness professional who works with women, we have a certification called our pre and postnatal coaching certification. It is the world's only comprehensive, evidence-based, interdisciplinary pre and postnatal coaching certification. Comes with a 500-page hardcover textbook and a 100-page workbook, online portal filled with videos, many of them of Marika. So we worked with a ton of different, PhDs, pelvic health physios, psychologists, behavior change experts, strength coaches to create the certification, because literally nothing out there exists that covers everything, right? You'll have some great continuing education courses, maybe postnatal exercise from one particular professional, or, postpartum nutrition or whatever, but nothing brought it all together. So we were really excited to be able to do that through the GGS Academy. So we definitely recommend that certification. And then we've got a ton of free courses on the topic, everything from exercises to do and avoid during and after pregnancy, a whole course on pelvic health, a whole course on returning to exercise postpartum. So any topic that you have, you can do a quick Google search of that topic and Girls Gone Strong. So can I run during pregnancy? Girls Gone Strong. Diastasis recti, Girls Gone Strong. You can find all that. And then if you're interested in the certification, the pre and postnatal coaching certification is the best place to go for that. And then we have a closed Facebook group for health and fitness professionals. It's called GGS Coaching and Training Women. There are like 36,000 professionals in there, I think, current and aspiring. So even if you want to be a professional, you're not quite yet, people from all disciplines that are in there. It's a really well moderated group. It's one of the few Facebook groups on Facebook that doesn't suck really bad, So people are supportive, uplifting, warm, welcoming. And then Marika also has her own podcast with her dear friend Anthony Lowe, where you can hear all things women's health. Marika, you want to shout that out?
How rude is that, promoting a podcast on a podcast?
No, that is what we are here to do, to uplift.
That's what we plan on doing on Joe Rogan. So
yeah, that's sort of the eventual goal, is to be hosted by Joe Rogan to promote iron culture.
Mm-hmm.
Awesome. And you keep saying, Joe, my phone's connected. I'm waiting. I'm here.
He does better with email. Yeah.
We have a podcast called the Women's Health Podcast, and that's with myself and one of my colleagues in Sydney, Anthony Lowe, also known as the Physio Detective. So he comes from a CrossFit plus strength and conditioning background. He's a physio, but he works a lot with women, predominantly those who have had like pregnancy, postnatal concerns. And I'm obviously based in Perth, and we interview people all over the globe about anything related to women's health, to be honest. We talk about bladders and bowels, and we talk about what else? Anything really.
Body image. I mean, you've had me on there.
We've had Molly a couple of times doing some awesome things. So yeah, we just kind of, we keep it really varied and pretty relaxed. we don't have the stand-up skills of you fellas yet. Might have to work on that. But yeah, if anyone's interested in women's health and working with women, it's a great place to start. And you can just flick through and find something that's relevant for you. But yeah.
Awesome. Well, I just want to thank you both very sincerely for coming on. This is a fantastic topic. I know that it will be beneficial to a lot of our listeners. We have a lot of trainers who listen, and I think we have some women who are still hanging around despite us promoting the Out Alpha Tour. So for those masochistic women, I guess, who are still listening, thank you so much for coming on. And Omar, if you could please close out another fantastic episode of The Cult, I will put that in your very capable hands.
Now, Aini, I will say that there is one, if we're just doing a little housekeeping, there was one topic that I think that we could have covered a little bit more, and that is there was so much. I want to echo what Eric said. I think this was truly a fantastic episode. I think all listeners are going to learn a hell of a lot postnatal. But I think a fundamental question wasn't answered, and that's how does one get pregnant? Which
yes.
wasn't, you see, I'm 12 years old, and so this topic, I feel a lot of words were thrown out, and I only understood about 33% of them.
We need to give you the talk.
Okay.
You want to talk the birds and the bees?
Whatever you
Omar,
think.
maybe we could do that one off air.
Okay.
They've been very generous with their time. I'm sure you guys can hang out on Skype for the next few minutes. But for now, why don't we just close out that podcast? 'Cause as much as I appreciate your need to learn this, I do think most of the cult probably has that piece of nuance down.
Oh, okay.
Yes, and I'm going to have urge urinary incontinence from drinking so many beverages on here and have to pee and not be able to make it to the bathroom if we stay on, since we've been on for 2.5 hours now.
So it's on Marika to give you the talk. That's what I heard there.
I look forward to it, and the only reason why I brought that up is, honestly, I don't know if y'all know this, but we are categorized in the health and fitness category on iTunes. We're waging eternal war against our competitors. We honestly forgot about Stronger by Science until you guys mentioned it, because we're crushing every other fitness podcast. But this is a true story. Pretty much all the other podcasts ahead of us in the health and fitness space are sexual health podcasts. So I thought that question was relevant to help us trend in that category, but we could save that for another episode. I do want to thank both.
A whole episode on sex. Yeah, that's fine.
Yeah,
You know?
I mean, if we've been trying to make the pivot on our own, and people keep just telling us,
Don't.
you're grossing me out, and you are absolutely, based on the limited times you talked about it, not experts in this area. So we definitely need help in that regard, or we're going to be stuck in a solid mid-40s in the health and fitness category.
But we will make sure to link everyone's social media, all the relevant links for the Girls Gone Strong in the description on iTunes, on YouTube. If you enjoyed this episode, go ahead and leave us a rating review. If you didn't, don't leave a review. Just don't bother. It's a lot of effort for you. On YouTube, you could go ahead and leave a comment. We'll do our best to respond. We're back every single Monday. We'll see you in that next episode.